us, health officials in some of Ghana's regional capitals are lamenting significant delays in the release of COVID-19 test results. It comes as a number of active cases reported by the Ghana Health Service has seen a consistent decline in recent times. From 3,253 reported on August 4, the number of active cases have declined consistently to 1,906 on August 11. The decline corresponds with the number of persons receiving treatment in health facilities. Senior health workers at the country's main COVID-19 treatment center at the East Municipal Hospital say the number of patients on admission has reduced. Though they say this is encouraging, they're urging members of the public to continue to observe the safety protocols. They spoke with Joynews on the sidelines of a donation of PPEs to the facility by MultiChoice Ghana.
We have really fought it, from the government right down to the health workers and to everybody. The fight against it has been very strong, and I believe that is what has necessitated the low numbers. And so let's continue doing the fighting.
Can we confirm that we began receiving less numbers of COVID-19 at this facility?
Yes, we have done. Yes, at the moment we have, as compared to from the onset, at the moment we have about 12 cases.
And at this time last month, you had more than that?
More than that. We've treated over 600 and over, but at the moment we have only 12.
So we can confirm that numbers have been down?
Yes, definitely. Even ICU, we don't have any case there.
Managing Director of MultiChoice Ghana, Cecil Sunquat Mills, applauded frontline workers for their efforts in reducing the number of active cases.
Today we've gone another step, and in fact, if I say today, yesterday and today, we have done 2 donations for PPEs, namely 10,000 and K45 masks, and then also what we call disposable isolation gowns. We actually came up with this based on feedback we got from the COVID trust in the hospitals. So this morning, yesterday we were in Konfanoche, we gave them 5,000 each, and then we've done the same for Gais. This has a total value of about 600,000 cedis, which we've done as a donation. And we like to acknowledge the effort by the frontline staff, and of course, the government, and specifically also, I know the president has put in a lot, and other agencies, for Ghana to get to this stage where we've seen a decline in the numbers.
Many analysts have, however, criticized the Ghana Health Service for deliberately slowing down testing to give impression the pandemic is under control. A number of regions, namely Upper West, East, Savannah and the Northeast regions, according to the Health Service, have no active cases. But Joynews' checks suggest a number of regions with 0 active cases have suspected cases being treated in hospitals but are yet to have confirmation of their status as their COVID-19 test results are not forthcoming. Joining us from the Upper West region, one of those with 0 active cases is correspondent Rafiq Salam. Rafiq, what is the COVID-19 situation in the region where you are? Kindly unmute, Rafiq. Rafiq, kindly unmute for me.
Hello, are you getting me?
Yes.
Okay, in the Upper West region, the region recorded 88 confirmed cases, with 3 deaths. As I speak to you now, the region, they are having 3 suspected cases at the regional hospital. And then also, one thing that they have been lamenting about has to do with the delay in test results being brought to the region. Because I spoke to some health officials who spoke to me under condition of anonymity, and they told me that they have gotten over thousands of samples that have been sent, and they are yet to get the results. Over 3 months, they haven't gotten those results. And so, but they continue to send those samples. Let me give you the statistics, the numbers that they gave out. The last time that they had results, test results from Tamale coming into the region was on the 27th of July, 2020. And these results samples were sent there on the 5th of June. So over a month, they haven't gotten these results. But authorities here continue to send samples and they are not getting results. So every day, day in, day out, weekly by weekly, they are sending results, but they are yet to get the test results are being returned to them.
Let me go to Albert Sorry, who is also in the Upper East. Albert, when was the last time samples were collected and are those results in?
Yes, Aisha. So this evening I spoke with the Upper East Regional Director of Health Services, Dr. Winfred Ofosu, and he told me that they have up to 260 samples in Tamale that they are waiting, to be tested, and the results are being sent to them. He said that these 260 samples were collected over the last 3 weeks, and so they are waiting for the tests to be done in Tamale for them to know the result. What we also know is that for now, the Upper East region does not have an active case of COVID-19. And the other thing that health authorities are trying to do is to equip the Navrongo Health Research Center to do sample testing as well. And so what the health director told me was that they are far advanced with the preparation of the Navrongo Health Research Center. And he's hoping that in the next 1 week, they should be able to, collaborate with officials from Accra who will do the training for the lab people that they have here, to help them prepare and go into testing. He says that almost everything is ready. They just need a few more of the laboratory equipment and the PPE, which the laboratory personnel will use when they do start the testing. And so latest in the next 1 or 2 weeks, the Navrongo Health Research Center should be able to, start, doing COVID-19 tests.
Peter Seno is in the Ochi region. Peter, paint a picture for me how the situation looks like in your region. Peter, you're on Joynews Prime. I want you to explain to me and let me understand how the situation with our COVID-19, dealing with COVID, I'm told we've lost Peter Seno there. Let me go back to Rafiq Salam. Rafiq, in your region, what can you say about the protocols, the observation of the COVID-19 protocols?
I will tell you that observing the protocols here it's nothing to write home about. I can tell you that you can count as many as out of 50 people, only one person will be wearing the nose mask. And so the protocols here are not being adhered to. The only few places that I can tell you that they are adhering to should be the social distancing, who has to deal with the churches, and then also some of our mosques are here. And so it's really a big war here in the Upper West region. One thing that I would like to bring to the fore has to deal with the issue of the people who are dealing with the COVID-19 patients at the hospital. They are talking about lack of staff. You go to a place like the regional hospital, only about 5 nurses have been dedicated to this particular holding center, and then which is really a worry to them. But to add insult to injury, these are the people who are also supposed to bury the dead ones. And so for them, they are having more than, they are biting more than they could chew.
Do you think the fact that the region has recorded 0 cases is part of the reason people are behaving this way?
Yes, the people will tell you that when you meet several people, they will tell you that yes, if the health authorities are telling us that we have no active case in the region, that clearly means that there's nothing to observe these social distancing or these health protocols. And so that may be another reason why people are not adhering to it. But you see, old habits that hard.
But, Albert, sorry, is the situation different from where you are?
Aisha, I wouldn't say it's so different because, again, just like Rafiq has said, it seems that for some time now, the usual anticipation that people have in terms of waiting for updates of COVID-19 cases, you know, when COVID-19 started, people were always anxious to listen. But it seems that all that has died down now. Now, when you attend public functions, you find that they do observe safety protocols and social distancing. What happens is that when you are in town, most people don't wear face masks like they used to when COVID-19 started. That is one observation that I have made. In town, a lot of people tend not to wear the face masks that much, compared to when COVID-19 started. But with public gatherings, people wear them because the expectation is that authorities may be watching. So they try to observe the safety protocols and then maintain social distancing as well.
Albert Sorry is our correspondent in the Upper East region. Rafiq Salam is also in the Upper West region. I'm told Peter Seno is back. Peter, paint a picture for me how the situation looks like in your region. Kindly unmute, Peter, you're still muted.
Yeah, Aisha, as we speak, 9 new cases, including 1 health staff, have been confirmed here in the OT region. And then cumulatively, the region has 213 cases, 47 of which we are told are from 5 schools in the region. And then out of that 47, 46 of them have been discharged with 1 active case, we are told. And then 62 health staff have also been infected in the region, with 61 of them, discharged with 1 active case, we are told, on treatment now. And then of these, 44 recoveries with 50 discharges, giving us a total of 194. And again, we have 11 cases on treatment in various isolation centers. And then we are told that we have 3 COVID-19 related deaths as we speak in the region. And then 3 lab results pending. Aisha.
Tell me about the level of testing in that region and the challenges being faced, because the last time we heard, the region was facing lack of funds in fighting the COVID-19 pandemic. What's the situation now?
Well, nothing has changed much as far as I know it. Authorities here wouldn't talk much except for our sources that we can find very little from as we speak. And so, well, the last time I checked, there were a number of cases which results are pending. But as we speak now, official document says 3 lab results pending. And so that is what we can speak to officially. Aisha.
Peter Seno is our correspondent in the OT region. We have our eye on the situation and we'll be bringing you minute-by-minute updates on the situation. Now, Nana Kofi Kwache is a research fellow and adjunct assistant professor in the Department of Health Policy and Management at New York University School of Global Public Health. He also joins us via Zoom. I'm grateful for your time.
Thank you for having me, and good evening.
You're concerned about the late reporting of COVID deaths.
Yes, we've been noticing a trend in the last, well, really since Manasseh Azure published his article with respect to delays between when deaths are reported on the regional SITREPs and when they actually reflect in the national. And in tracking how far back some of these delays go, the time lags we're seeing seem to beg some explanation of exactly what the review process entails. I'll give you an example. On August 9th, we had 8 additional deaths reported. The oldest of those deaths actually went as far back, I believe, as June 15th. So we know that, of course, there's a review process to validate the data, but it is taking quite a bit longer than usual. Now, in a country like ours, one of the reasons why we have to really make extra efforts to have accuracy on the data we do have and candor about the delays that do exist in the data is because we're already going to have a quite hard time estimating the total burden in terms of mortality of COVID-19. It's not just a question of the deaths that we know that are confirmed, but those deaths that we're unable to actually pick up because of poor testing in a country where there's already low health utilization, and because of poor morbidity surveillance and mortality surveillance, which means we are likely to miss quite a bit. So we should at least be getting some kind of provisional data that points to cases that are currently being reviewed. So we know, or I say deaths that are under review. So we know just how many of them there actually are. Because if you look at when the majority of our deaths actually happened, if you look at the histograms that the Ghana Health Service is putting out, one would assume that, July or, somewhere in July was pretty much the most lethal week of COVID-19 in Ghana. But since July 28th, none of the deaths that actually have been updated in that time reflect to the period after. So we know that the spikes in death often follow the spikes in infections. And most of the data we should be seeing, if these were relatively newer deaths, would have to do with that spike in infections we saw in late June, in the 4th week of June. That hasn't reflected yet in the mortality data. So you have two options in kind of a way where, on one hand, you're either saying that despite a massive surge at the end of June, almost nobody from that group got critically ill or suffered any serious consequences, or we are just not putting out that data yet. And if those are still in the review process, given that they would correspond to a period of high infections, it helps with risk perception and risk understanding if we at least know how many of those reported deaths are under review. Now, it's useful because we want to be able to make correct estimates of things like our fatality data. So what we are looking at right now is a case where we are still finding out the actual mortality of COVID-19 in Ghana, sometimes 8 weeks, sometimes 6 weeks after it actually occurs.
Clarify this for me, Nana. How really does this impact on the fight against COVID-19, the late reporting?
Well, like I said, what we're trying to do is to estimate things like the total mortality burden of COVID-19. The data on deaths, as I've said a couple of times on different shows, doesn't affect necessarily our planning around what we do next, but it is useful for us to understand how serious the actual our local epidemic is. It allows us to actually get a correct estimate of things like how we can plan further ahead in the pandemic and to study that data that we're getting to understand what the dynamics are over time. Now, any lagging indicator like deaths or hospitalizations, those are data about management and consequences. So what we want to really focusing on when it comes to actual interventions really would be the infection rates and the test positivity rates. But the death data actually allows us to really study and understand the nuances and consequences of those infections.
I'm grateful for your time. Nana Kofi Kwache is a health analyst and an adjunct professor all the way from the United States.